Just days after suffering a massive stroke, actor Luke Perry has died. He was 52 years old. He was rushed to the hospital on Wednesday after a stroke at his home in Los Angeles. Perry is among 140,000 Americans who die each year from stroke, according to the Centers for Disease Control. It is the fifth leading cause of death for Americans. Dr. Ken Redcross is with me, a board-certified physician in internal medicine. Yes, we hear of people dying of stroke, but you usually think of that being somebody who's 75, 80, 85 years old, not 52.
No, you really don't. The sad thing here, Pat, is this is a trend that we're seeing, but it's also important to talk about that when we see things like this. The good thing is that we do know that strokes are 80% preventable. So there are some things that we can talk about, not only to prevent, but also to repair and recover as well. So
you brought a bunch of things here to illustrate some of your points on this. Where do you want to start on all of these?
You know, we'll start over here because one of the things that's important, especially for stroke health, is our blood pressure. You know, 1 in 6 people have no idea what their blood pressure actually is. I brought this one in particular, Pat, because this one is wonderful in that it's electronic. It makes it a little bit fun to really focus on your health. You can have it actually go to your smartphone even. So it's important that we're staying within that 120 over 80 that I think we all have kind of been growing up and understanding a bit.
You've got some pills here.
I do, because one of the things, so the thing when we talk about blood pressure is more on prevention, but what about to repair and recover? One of the things that we have that our body makes naturally is actually called citicoline. Citicoline is incredibly important, but one of the better ways to get the benefit for the repair and regeneration of our brain cells is with a supplement called Cerenx. It actually has studies behind it. That's why I mentioned that one, over 100 clinical studies as far as for repair of the brain tissue, should you have an incident.
Let's put up a screen that summarizes some of the points that you've got here. Monitor blood pressure, take citicoline. We've got garlic and olive oil and sweet potatoes set out in front of us. You say drinking coffee is helpful for stroke prevention?
It is, and it's interesting because you never know what kind of story you're going to get when you see coffee. Well, this is a good story because we know that actually drinking 1 cup of coffee a day has been shown to lower the incidence of having a stroke. And for those who are tea drinkers like myself, it's actually 4 cups of green tea to kind of equal the benefits that coffee gives you for stroke prevention and health.
Why do you have an alarm clock there?
I have an alarm clock here because it's incredibly important. Do not oversleep. The studies show that if you're getting 10 hours of sleep, which I probably bet you're not getting, Pat, but the thing is if you're getting over 10 hours of sleep, it actually increases your risk for stroke. So it also can show that you may have sleep apnea. So we want to be careful about that as well.
When you look at the shock over the death of Luke Perry or someone of that age, are there diet factors that could, I mean, if he knew in the last couple of years that he was at risk, are you too late to do something about it?
You know, you really aren't, and that was the reason why I brought some of these things. We know that if, for instance, having a good amount of garlic in your diet because of the allicin that's in the garlic itself, we know that that decreases your risk by 50%. We know olive oil helps by about 40%. So yes, there are some things that we can do in our diet to make a huge difference.
Who knows that does your doctor realize you're at risk? Can you see warning signs yourself?
You know, you really can. Well, the warning signs acutely of a stroke, you can really think of the acronym FAST. Facial droop, arm weakness, slurred speech, and the T of FAST means it's time to make sure you call your doctor or EMS should you have those other symptoms.
What about the male-female divide?
Yeah, and a lot of that we're thinking probably is because of the hormonal differences that we see lots of times as well. The other trend that we're seeing, as you mentioned before, is that we're starting to see those who are younger are also starting to have a stroke now. So this isn't a disease of old people at all anymore.
Good to have you in this morning, Ken. Thank you.